Hi, my name is Brandon Hess, and I'm a certified veterinary practice manager, and I'm also certified in compassion fatigue. Thank you for taking a few moments to watch this webinar titled Compassion Fatigue, the Career Killer. Now, my formal education is in psychology, but when I first entered the industry, what I had noticed was people that initially had a lot of passion about the field and position that they had, slowly lost that over time. And as I worked my way through different positions in the hospital, and now I'm currently a practice owner. In the state of Kentucky, you don't have to be a DVM to own part of a practice. So I understand the impact that this field has throughout the whole practice. I've had veterinarians come to me and talk about leaving the industry. I've had good friends come to me and talk to me about leaving the industry, even peers that have suffered extreme sides of compassion fatigue and burnout. So the reason I wanted to talk about this today is really to educate and normalize our industry as much as possible so that people understand the challenges that are within this industry, how to identify them, and how to deal with them on a day-to-day basis. So first, let's talk about the why behind compassion fatigue. I think it's always smart, kind of Simon Sinek's approach, to start with why, so to make sure that we're all talking about the same thing and why this is important to talk about. So in a practice setting, this is kind of the cycle that I see with compassion fatigue and burnout and how it impacts the practice. So starting on the left, as compassion fatigue goes up, so does stress within the practice. As stress goes up, communication tends to go down. And around the communication conflict side point of this cycle is generally when practices are reaching out to me as an independent consultant asking about culture, practice culture, staff turnover rates, because nobody likes going to work where communication is poor and conflict is high. So this is generally where I start to see cultural impacts within the practice, um, primarily because veterinary professionals and really people in general are conflict avoidant. So there's this whole conflict side of the work that we do and resolving that conflict not only within the practice, but also with clients. So when communication starts going down in practices, conflict goes up. And of course, nobody enjoys going to a workplace where there's this underlying conflict. There's conflict avoidance. They don't have the skills and training necessary to resolve conflict. So staff happiness goes down. And as staff happiness goes down, that's where it starts impacting the patients and the clients within the practice. And as people feel unsuccessful in the work they do, of course, they're not going to be happy about that. So as errors go up, customer service generally goes down because we're having to talk to the clients about the errors that we have with patients, with medical records, with diagnoses, whatever that may be. So today we're going to talk about what compassion fatigue is and what it's not. There tends to be some confusion, and I think about it like diagnosing a medical condition. If you don't know what the symptoms of that medical condition are, what it looks like, then you're unable to diagnose it appropriately. So it's important to know what exactly it is and what it's not. And then we're going to look at causes and symptoms of compassion fatigue. So what does it look like? What are the actual symptoms so that you can identify, okay, this is compassion fatigue or this may be burnout. So let's talk about what it is and what it's not. So the kind of quote unquote father of compassion fatigue, his name is Dr. Charles Figley. He's currently a head professor at Tulane University. And he wrote the first book on compassion fatigue in general in the mid-90s. And then he also wrote a book that I had to study to get my CCFP, my Certified Compassion Fatigue Professional, called the Compassion Fatigue in the Animal Care Community. He co-authored that with Dr. Roop, and he made the statement in the book that I thought was a pretty good summary, and this will make sense as we go through future slides. But he says there is a cost to caring. Professionals who listen to clients' stories of fear, pain, and suffering may feel similar fear, pain, and suffering because they care. Sometimes we feel we are losing our own sense of self to the clients we serve. And that's really what I see in our industry a lot is we're too busy taking care of other people, our clients, our patients, sometimes each other, that we don't take the time to take care of ourselves. Kind of like, when you're flying on an airplane and they say, in the case of loss of cabin pressure, please secure your own oxygen mask before securing others or helping others secure their own mask. And that's kind of the opposite of what we do. We're too busy securing the mask of other people that we don't take the time to take care of ourselves. Now, I had the pleasure of meeting Dr. Charles Figley at Tulane University, and he was a very nice gentleman, and he's written a lot of books on compassion fatigue, burnout, and he actually helped coin the term before writing the book about compassion fatigue, and it started with the nursing industry, and what they found in the nursing field was as nurses worked more and more on taking care of other people, under other individuals, they started taking care of themselves less. And as stress went up, susceptibility to compassion fatigue went up, and the less that you took care of yourself, the more susceptible you were to symptoms of compassion fatigue. So it was great to sit with Dr. Charles Figley and talk about his experiences directly with compassion fatigue as a therapist and social worker, the work that he's done, but also how he's seen that happen in other industries, such as the dental industry. So if you don't know already, the dental industry used to be the highest rate of suicide in caretaking fields, and now veterinary medicine has surpassed them. And it was interesting to sit with Dr. Figley and talk about why the dental industry, dentists in particular, had such a high rate of suicide. But if you do any work on compassion fatigue or read articles or read books, you will very likely come across the works of Dr. Charles Figley. So let's start with talking about what compassion fatigue is not. Compassion fatigue is not burnout. Burnout can happen in any industry. And the reason I like to talk about this is because a lot of times I hear people say, well, I'm burnout or I'm experiencing compassion fatigue, and they're using the wrong term for the wrong thing. So it's important for me that veterinary professionals know exactly what they're talking about. If they feel something, is this burnout or is this compassion fatigue? And I'll give you a few ways to differentiate between the two. So as I mentioned, burnout can happen in any industry. So I used to work in retail sales through college, and I could experience burnout in retail sales, but I can't experience compassion fatigue. Burnout is also defined as the overall just decrease of job satisfaction. It does have a lot of the same symptoms and can happen as a result of unresolved compassion fatigue. So if you ever come across any articles that I've written, I talk about compassion fatigue induced burnout. So basically burnout as a result of unmanaged or unresolved compassion fatigue. So burnout, a few other differentiators between burnout and compassion fatigue. Burnout happens over a longer period of time, whereas compassion fatigue can happen from just one instance. And I defined compassion fatigue on the next slide, so we'll talk more about that. So burnout takes longer to come on. Burnout also takes longer to resolve. Sometimes there's no recovering from burnout. Compassion fatigue generally resolves with time away from the work that you do. So time away from being a caregiver, so a vacation. One way that I help people differentiate between compassion fatigue and burnout is if you're just feeling exhausted and you're tired, you don't want to go to work, you're dreading going to work, you're dreading dealing with people, take a vacation, more than 2 or 3 days off. If you come back to work the same way, feeling the same way as you did when you left work, so you dread coming back to work even with time away from work, you're more than likely burnout. And there's different levels of burnout, but burnout does not resolve as easily as compassion fatigue. And Dr. Figley actually says that sometimes the only way to get away from burnout is actually to leave your role as a caretaker. And that's generally where we see people leaving the industry. I also want to say that compassion fatigue is not the absence of compassion. So I've read many articles, and one of them in particular, actually I think they use like the Wikipedia definition of compassion fatigue, which is not Dr. Charles Figley's definition of compassion fatigue. And the article is actually titled "The Myth of Compassion Fatigue." And what they said in that article is, I never experienced compassion fatigue because I never lose compassion for my clients or patients, and that's great. But that's not actually not the definition of compassion fatigue. Compassion fatigue is exhaustion and stress as a result of providing compassion on a day-to-day basis. Basically, the demand to provide compassion, not the absence of providing compassion. So when we look at compassion fatigue, it's very important to me that people understand this is a natural result of being a caregiver. When I say natural, I want people to understand that there's nothing wrong with the way that the stress of this field makes them feel. And there's nothing wrong with feeling exhausted. There's nothing wrong with dreading going to work. This is a very challenging field, a challenging field mentally for everyone, and then you add personal stressors on top of that. So it's important to understand that compassion fatigue and compassion fatigue induced burnout is natural. The approach that I generally take to this is anticipating and managing compassion fatigue, which we don't have time to get into today. If you're interested in that, I'll give you a resource page to go read some articles that I've written. But anticipating and managing, not avoiding compassion fatigue. There's no avoiding compassion fatigue in the work that we do in this industry. Compassion fatigue comes from witnessing others' pain and suffering. And if you go down to the last point there, we talk about secondary traumatic stress. So secondary traumatic stress is basically stress from experiencing something secondarily. So I always like to use the example of PTSD, post-traumatic stress disorder, is stress and a diagnosable condition from witnessing something from a primary perspective. So my brother is a war veteran, and he goes to war. He comes back with PTSD from the things that he saw directly. And when he explains those things to me, I can experience secondary traumatic stress from his primary experiences. So now let's link that to the work that we do. We have clients that come in that talk about running over their own pet, the stress of taking care of an elderly pet, elderly clients that are putting down their pet and that's all they have left. They lost their significant other. So we experience stress secondary to other people's stress, the clients and the patients that we take care of. Now, compassion fatigue is empathy driven with external stressors. And in the field and the work that we do, we're naturally empathetic people. So the empathy is always there. And the higher the empathy for a client, the higher the susceptibility to compassion fatigue. So I have a dachshund, or had a dachshund rather, and if a client comes in with a dachshund that's sick or injured, my empathy for that client is higher than it may be for other clients because I can actually relate to what it would be like for that to be my dog. So in those instances, I have a higher susceptibility to experience compassion fatigue from that engagement because I have a higher level of empathy. And as mentioned, it can be one or cumulative events that cause compassion fatigue. So we use the term secondary traumatic stress, and Dr. Figley says that this is from helping or wanting to help a traumatized or suffering person. It's from hearing about someone else's firsthand trauma. And in the veterinary industry, a lot of times our hands are tied. So we fall into that wanting to help a traumatized or suffering person, individual, patient, pet, whatever that may be. And we can't because let's say the client doesn't have money and they want to take care of this pet, but they can't afford to take care of this pet. That's stressful, especially on the veterinarian who's took an oath to help and finances are in the way. Or maybe you have a client that has the money but won't spend it on a very simple treatment. I've had clients where they will actually offer to mortgage their house to get the money to continue treatment on a pet that may not even be treatable. Sometimes we want to help, but we can't because of a lack of technology or a lack of resources. So there's a lot of times where we're put in a position where we want to help a pet that's suffering and the client wants us to keep it alive for hours or days until other family members can get there, a husband or a wife or someone out of the state. So basically we're prolonging the suffering sometimes and trying to make this pet as comfortable as possible to placate these owners' demands. And with secondary traumatic stress, I mentioned it's a little similar to PTSD. It's different in that PTSD is a diagnosable medical condition, but secondary traumatic stress counselors for post 9/11 first responders. So there's articles upon articles written about secondary traumatic stress and the impact that counselors had from counseling post 9/11 first responders. Those first responders have PTSD. They'd go to therapy sessions. They talk to the therapist about the horrific things that they saw on ground zero. That therapist experiences secondary traumatic stress to the point where it causes burnout or compassion fatigue. And a lot of times there's actually articles written about therapists that absorbed the same triggers as their client. So, a trigger for a war veteran could be a loud noise or a crowded space. For some for ground zero 9/11 first responders, one in particular, it was an elevator ding. Because they were on ground zero at the elevators. And there was an article written about a therapist that had such high levels of secondary traumatic stress that they actually started having triggers of elevator dings, and they couldn't go into buildings because of the trauma that they experienced secondarily to this first responders direct primary post-traumatic stress disorder. So once again, just trying to correlate PTSD and secondary traumatic stress. It's not the same thing. So as I mentioned, PTSD is a diagnosable medical condition, and secondary traumatic stress is not. So that's what it is and what it is not. So as a summary, it is not burnout. Burnout happens over a longer period of time and it's harder to resolve from. Compassion fatigue happens over a shorter period of time, sometimes from just one instance, and it resolves a lot quicker. So those are some of the most substantial differences between compassion fatigue and burnout. And burnout or compassion fatigue is not the lack of compassion. And another pitfall that I see in practices is, we have these practice owners or these experienced veterinarians who have been in the industry for a long time, and they don't believe in compassion fatigue. So they actually have a mindset of, well, I've never experienced compassion fatigue, so other people don't either, which is a huge pitfall because that just kind of assumes that the other people in the practice think of things and process things the same way that you do. And I've come across many owners that after workshops and educational sessions, they realize that they have, just built up more resilience, or they have figured out ways to compartmentalize or process the trauma that they experience on a daily basis. And that doesn't necessarily mean that others within the practice feel or have the same. Okay, so let's talk about the causes of compassion fatigue. So we talked about an empathetic capability. So two things must be present to experience compassion fatigue. You must have an empathetic capability, so capable of empathy, which we all are. We're just practicing empathy at a different level, depending on the situation. And you must have a caregiving relationship. So this is another differentiator between burnout and compassion fatigue. Only caregivers can experience compassion fatigue. You must be in a caregiving relationship. Now, there's other industries that experience compassion fatigue. We talked about the human field. Dentistry dentists can experience compassion fatigue. Teachers, police officers, firefighters. Therapists, we talk about nursing home workers. It's interesting because nursing home workers have a very bad reputation for abusing their patients. And without getting into it too much, I feel that is the way that their burnout and compassion fatigue manifests itself. Not making an excuse at all, because it's inexcusable action. But they're not educated on, I've actually talked to many nursing home workers, and they're not educated on compassion fatigue. They're not educated on burnout or how to deal with the traumatic things that they experience and taking care of the patients that they experience on a daily basis. So these two things must be present to experience compassion fatigue. Now, empathy, just to summarize what empathy is, I always say that empathy is figuratively being able to put yourself in someone else's shoes. So be able to feel what they feel, be able to kind of appreciate what they're going through, and understand what they're going through. And the more that you can relate to a person, the more that it's easier to empathize with them. So let's say, we have a veterinary professional that's going through a divorce, and a client comes in and they share stories about their own divorce process that they're going through, and this pet and what it means to them and how it's important to save them. That veterinary professional is able to practice a higher level of empathy with that client, because they can figuratively be able to put themselves in that client's shoes. So it's important for veterinary professionals to understand that the higher empathetic capability that you have with the client, the higher susceptibility you have of an emotional impact of that interaction. So just like I use dachshunds, my grandfather just recently passed away from bone cancer. So if a client was to come in and tell me about something that had to do with cancer, and their pet and their family, I would be able to practice a higher level of empathy, because I can understand what it's like for a family member to go through that. So that goes to the anticipating side of compassion fatigue, being able to look at a situation and practice a level of emotional intelligence where you can look at it and say, yeah, I'm in this situation. I'm susceptible. I'm susceptible to compassion fatigue. This has the potential of having a pretty large emotional impact on me. Now, in the book, Compassion Fatigue in the Animal Care Community, Dr. Charles Figley surveyed thousands of veterinary practices, and they said, hey, what are your top stressors as veterinarians and veterinary support staff? What are your top 3 stressors in the work that you do? And it was interesting to see the results of this. And I get the same thing when I travel around the United States and I do workshops with veterinarians or veterinary professionals, regardless of the size of the practice or the demographics of the practice. I hear these same exact things. Difficult non-compliant clients. So this is a people business. My first mentor said to me, I've never seen a dog walk in with a credit card and pay for their own bill. This is very much a people business. So those clients, difficult, non-compliant, not following through with the recommendations that we give them, taking care of a patient and letting them walk out the doors with a client that probably is not going to take care of them the way that you want them to be taken care of, and having to ethically allow that patient to go home with that client. That's challenging for many veterinary professionals. So with the veterinarians, number 2 is not enough time. So another way that I hear veterinarians tell me is too much to do, not enough time to do it. So staying after work to type medical records, being forced to rush an appointment because you have another one coming in. Not having enough time to process the things that you experience. So going from a euthanasia to a new puppy exam, to a new puppy exam, to a euthanasia, and not having the time to process, and you're forced to compartmentalize these things, but not taking the time to process that, not feeling like you have enough time, and not feeling like, I even have people say, well, this is what I signed up for. I should be able to deal with this. And that's not true. It's not true that you're expected to just deal with it. There's help out there, and there's nothing wrong with reaching out for help. Number 2 on veterinary support staff, problem with coworkers. So we go back to one of the first slides that we started on, and we talked about communication and conflict resolution, and how that impacts the culture of the practice. Well, as communication and conflict resolution go up, empathy generally goes down for each other. So we're practicing less empathy for each other and our clients, because of the communication and conflict issues within the practice. And then for number 3 on veterinary support staff, not enough time, which is the same for number 2. And then number 3 for veterinarians, discussing and disputing fees. So it kind of goes back to that wanting to help. You can't because of money, and as a veterinarian, you don't want money to limit how you're able to help a patient. What's interesting is when we look at all these things, and I have practices and veterinary professionals brainstorm on these things, the next thing I say is, how many of these things are going away tomorrow? When you go to work or you go to school, vet school, tech school, whatever that may be, how many these things are not going to be there? And the answer is none of them. All of these things are a part of what we do all day, every day. And a big part of anticipating and managing compassion fatigue is one, understanding that there's no avoiding it, and two, having realistic expectations that these things are not going away. So how do I learn to better deal with these, cope with these, build resilience, build outlets, and not compartmentalize these things and hope they're just going to go away. When you compartmentalize something and you hope it's just going to go away, it never does. Conflict never just goes away. Compassion fatigue never just goes away. Burnout never just goes away. It impacts all of the future experiences and jobs that you do. So it's important to recognize that these things are going to happen. There's no avoiding these. You just have to better anticipate and manage them. If you have difficult or non-compliant clients, so when I have practices brainstorm this, I have them think about their triggers that cause compassion fatigue, their triggers that cause stress in their daily work, and brainstorm on how they can better anticipate, manage, or maybe avoid them when possible. So let's say you have a client, Miss Smith, and anytime Miss Smith is on the appointment screen, it makes you super stressed, and you don't want to deal with Miss Smith because you know how difficult or non-compliant she is. She's chatty, she's a time suck, whatever that may be. Well, why can't one of your other peers who has less of a difficult time with Miss Smith take care of Miss Smith for you or see that appointment? So it all goes into anticipating and managing compassion fatigue as much as possible. So there's some additional stressors that I've seen as I've gone through workshops with practices and at conferences. Just the overall demands of the job, lack of clarity about responsibilities. So, practices that don't have job descriptions in place, practices that don't have employee manuals in place, practices that don't hold staff accountable for not doing their job. There's just this kind of overall lack of structure and management ownership pressures. So sometimes I get professionals who feel like there's unrealistic expectations on them from the management or the ownership team, and a lack of communication between those teams. Work-life balance or the lack thereof. And one thing that we don't talk about through this webinar are personal stressors. So the more personal stressors that people have in their lives. So it's interesting because around the holidays we have the highest euthanasia rate in the industry. We have the highest amount of personal stressors, financial, family problems, all of that kind of thing, which causes impaired immune systems. So that's one of the symptoms that we're going to talk about because people get sick. Veterinary professionals get sick a lot, and it shouldn't be surprising because it's the highest rate of compassion fatigue in our industry because of the highest rate of euthanasia. Client stress, personal stressors, and the higher your personal stressors, the more personal stress you have in your life, the more susceptibility you have to compassion fatigue. Because that all, it's great to say, hey, let's leave work at work and home at home, but that's not the way it works. We know that personal stressors impact the job that we do and the interactions that we have at work. So this is a chart that I put together for an article that I wrote for DVM 360. And one thing that I do just want to point out is in the title, this was not my choice. It says ABCs of avoiding compassion fatigue. I am very adamant that there's no avoiding compassion fatigue. There's only anticipating and managing. So I just wanted to point that out because that was not the wording of my choice, but the title of the article nonetheless. So this is a chart, kind of a flow chart that I put together for this article, and what we wanted to show is basically yes or no questions for a veterinary professional to understand if they're experiencing compassion fatigue or if they're experiencing burnout. And those symptoms, right, the second row of symptoms there is what we're going to be talking about next when we talk about how compassion fatigue manifests itself. So you're welcome to take a picture of this, or you can be found in this article, the ABCs of avoiding compassion fatigue, on DVM 360's website. So there's 6 categories of symptoms how compassion fatigue can manifest itself. Now, it's important to recognize that you may experience one or two of these symptoms, and all six of these categories. You may experience, just one of these symptoms. As we go through these, I'm not expecting you to notice that you experience all of them or even one in each category. The important part on these symptoms is to practice a high enough level of emotional intelligence that you recognize when you experience these symptoms, when you usually have not experienced these symptoms, or even, recognizing these symptoms in other people. And bringing it to their attention and saying, hey, you used to be really extroverted, you used to be really outgoing, but now you're demonstrating this behavioral symptom of being introverted and isolating yourself. That's one of the most concerning symptoms of compassion fatigue or burnout. So we're going to go through these 6 categories just rather briefly and look at these symptoms. And some of these symptoms, it's also important to mention that some of these symptoms are completely normal to experience on a day-to-day basis. So for instance, one of the symptoms is forgetfulness. Well, me personally, I'm a naturally forgetful person. So I forget things all the time. It's just part of my day-to-day life. It's part of my personality. But that doesn't mean that I'm always suffering from compassion fatigue. So once again, it's important to recognize these emotions or these symptoms in yourself or others when they're not normally demonstrated. So our first category is cognitive. So decreased self-esteem, apathy, so just overall not caring really about anything. Thoughts of self-harm or harming others. So this is really important for me, and we're not going to get into suicide awareness in this, but the suicide awareness is something that I talk about a lot, and it's a topic I don't dance around because I think we've danced around it long enough in our industry, and it's part of why we're seeing the problems that we're seeing. But obviously, when someone is experiencing that, and sometimes it comes out in a joking manner. So I've had veterinary professionals reach out to me and say, "Hey, one of my friends has been joking about harming themselves, and they say it's a joke, but I really feel like it's not. And this is not something to joke about. And anytime someone says something in a joking manner, it should not be taken as a joke. Sometimes it could be a cry for help. So thoughts of self-harm or harming others, minimization, so just kind of downplaying everything. Oh, it's not a big deal. I'm fine. It doesn't bother me. Just trying to minimize it. And to me, minimization is a form of compartmentalization. We're just going to try to push it back to the back of our mind and try to act like it's not a big deal when it is a big deal. Loss of meaning. So I've seen this in veterinarians a lot, and even veterinary support staff, where they felt a calling to veterinary medicine, but because of the impact of veterinary medicine, they feel like they've kind of lost their meaning and really lost their purpose, because we're all helpers. We want to help people, but whenever we feel like we can't do it anymore, then sometimes people feel like that they've lost their meaning or their calling. Emotional symptoms: anxiety, anger, rage, helplessness, depression, just feeling overall depleted. There were times in my career where I literally didn't want to decide what I was having for dinner. That was one decision that I had made decisions all day, every day, and I just overall depleted and just frustrated and irritable, which is more of a behavioral symptom, that I didn't even want to decide what we were going to have for dinner. The least decisions that I had to make in my personal life, the better. So when we look at behavioral, which is probably one of the most common areas of symptoms, you have impatience, moody, nightmares. So it's not uncommon for veterinary professionals to dream about work or have nightmares about work. This should be a symptom of burnout or high levels of compassion fatigue. Use of negative coping. So this could be substance abuse. And once again, it's important to recognize that this doesn't have to be to an extreme. So I'll use myself as an example. A few years ago, I would only have maybe one alcoholic drink a month. I just wasn't a big drinker. And as my stress went up and my burnout went up, I started having a drink more frequently, to the point where I was having one drink a night, which by all means is not alcoholism or isn't a bad thing at all, but it's a huge change from what I used to do to what I was doing at that point. My wife actually brought it to my attention, and what it was a form of negative coping. It was a drastic change in what I used to do to what I was doing now. So just noticing or having someone else point out those changes in yourself. Losing things, so I mentioned about that being a symptom, but some people are just naturally forgetful. But you might find yourself used to have a great memory and used to not lose things at all, and then all of a sudden you're losing things like crazy. I've had many people come to me and say, "Oh, I've been real stressed recently, and I've lost my cell phone every day, or I lose my car keys all the time." And then self-harm behavior. So once again, not a fun topic to think about, but suicide is a huge thing in our industry, and we have to recognize that and acknowledge that and kind of take it on head on. The spiritual symptoms. So some people may not experience spiritual symptoms. It really just depends on your level of spirituality and beliefs. So one of the things that I've seen in our industry that challenges people spiritually the most are euthanasia, or a client's lack of belief in euthanasia, to the point where they won't let a veterinary professional euthanize a pet because they believe in natural death. Well, depending on someone's spiritual beliefs, I've seen veterinary professionals struggle with this. They see it as suffering and cruelty, and based on their spiritual beliefs, it's not something that they believe in, but yet their hands are tied because of the beliefs of a client. So sometimes, depending on the spirituality of someone and their belief system, that can be challenged for them, depending on the experiences that they have. Interpersonal, withdrawn, decreased interest in intimacy, mistrust, isolation, and intolerance. This is probably one of the more severe categories of symptoms, because even organizations such as Harvard did a 75-year study that basically, in summary, what they were looking for is for people that rated their life the most satisfying and most successful. What was it about those people? Was it their income? Was it their health status? Was it their formal education? And what they could correlate it to was basically quality of personal and professional relationships. So whenever we start isolating ourselves from the people in our lives, or our professional friends or connections, that's one of the worst things that we can do. And sometimes what I see is this just small examples of, oh, I had dinner plans, but I'm so exhausted, I'm just going to cancel my dinner plans and stay home. Well, a lot of times that's just isolation. That's just a symptom of not wanting to people anymore. I've peopled all day. I don't want to people anymore. But the more that you isolate yourself from others, the worse that it gets. And there's been many times, even in my own career, where I didn't want to go out and hang out with anybody, but I forced myself to, and I actually didn't regret it. I really enjoyed it, and it helped me get my mind off of the stress that was going on. So my challenge to any veterinary professional is, when you see yourself in that spot, don't cancel your plans. Force yourself to even go out, and even if you don't go out for as long as everybody else goes out, just go out. That'll help get your mind off of the stresses. Physical. So I alluded to these a little bit when we talked about the time of the year that people tend to get sick. But the physical symptoms of stress and compassion fatigue and burnout, shock, aches and pains, impaired immune system, rapid heartbeat. So even in my consulting life, there will be times where I'm just traveling like crazy for weeks on end, and then I have 3 days off, and I'm sick all 3 of those days because I finally have time to slow down, and my physical symptoms kick in, and my immune system kicks in, and it takes a deep breath, and just all that stress manifests itself in just kind of exhaustion. And an impaired immune system. So you have to keep an eye on that and recognize that sometimes that can be a manifestation of the compassion fatigue or burnout that you're experiencing. So the last slide that I want to talk about is how you can measure your compassion fatigue or burnout, because I think it's important to quantitate like a diagnostic tool. Like how do you know the level of renal failure in your patient if you don't have a quantitative measure for that renal failure in the blood work that you do? So there's the Professional Quality of Life 5, the 5th version, the ProQual 5, and this is a measurement tool that's been normalized over all caretaking industries. So they've taken veterinary professionals, human professionals, all of those industries that we talked about earlier, and they've normalized their measurements over all of the industries. It's a very established tool. It's a readily available tool. You can Google ProQual 5, or I'll give you a website here in just a second to find it at, and you can actually measure your level of burnout or compassion fatigue. And I think that it also does secondary traumatic stress. So that's nice, because in the workshops that I do, I actually challenge people to measure those levels at that time, and then you can measure it again in 6 months or 9 months or a year, just like you would blood work, and see how things have changed for you. So let's say you're focusing on your own work-life balance and you implement changes. Well, if you measure it at the beginning of those changes and then after those changes, then you really know kind of a quantitative tool of how things have changed. What I had realized is with the ProQual 5 and normalizing that over all industries, it really didn't translate great to just the stresses of the veterinary profession. There's things that we deal with in the veterinary profession that no other caretaking industry deals with, euthanasia being the most obvious one. So I actually created the veterinary wellness assessment, which will be on the same website that I'll show you here in just a second, and it's specific to veterinary medicine. It's not as clinical or as established as the ProQual 5. I've normalized my scale over probably about 2,000 people so far, and the ProQual 5 is much more established, but it's more specific to veterinary medicine, and the questions are more specific to veterinary medicine. So these are two ways, free tools that you can use to measure your or someone else's level of burnout or compassion fatigue. And what's interesting, and this may be just the psychology geek in me, is I actually took these measurements and then I had my wife, or you can have your significant other, take them and evaluate them as if they're evaluating you. So it's interesting to know what I think my level of burnout is and how I would measure myself in each one of those categories. But it's even more interesting to know what someone close to me thinks, and how those correlate to each other. So that's something that you can do. You can have someone close to you in your life take this assessment. Now, what's important with that is you just want to know what the final score is. You don't want to know how they measured you in each one of those categories, because they might answer a question a different way if they're afraid of hurting your feelings with their answer. So what I suggest you do is have them get their score, and then have them throw away their paper immediately, so that there's no way that you know how they answered each individual question, because really all that you care about is the total score and how that score correlates to your score. So just something interesting that you can do, that some people choose to do. So that's the end of this webinar. I wanted to give you the website down there, the vetsupport.com/compassion fatigue. That has a lot of resources, articles that I've written, videos that I've created, videos off of YouTube about empathy. It also has the ProQual 5 and the veterinary wellness assessment on there. All of those things are completely free, to help educate veterinary professionals and give them resources to look at. My email's there. I'm very serious when I say that any veterinary professional can reach out to me if they ever need anything. And while I may not be able to be the solution, and often I can't be the solution for you, I can direct you in the right direction. So I've had people reach out to me with concerns about peers and suicide, or interested in workshops in their area, or more educational content. So don't hesitate to reach out to me. And thank you guys so much for your time. Those are my 3 babies over there. I just recently lost my little dachshund there, Gizmo, but that's my Dobie, Rudy, and my little border collie, Layla Chew. But my name is Brandon Hess. Thank you so much for spending a little time with me to learn more about compassion fatigue. And please don't hesitate to ever reach out if you need anything. Thank you.